Thanks so much for joining us on our WMAR-2 News Facebook Live. I am Megan Knight, joined by Dr. Frankel from GBMC. He's with their emergency department. And today we got a pretty timely topic, especially if you've been watching our meteorologist talking about the weather this week. It's going to be another hot and humid one. Mother Nature is just not letting go of summer just yet. We got to hold on just a little while, even though the Starbucks PSL is out today, which is crazy. But that's a whole other topic, because today we want to talk about a very serious topic, which is heat-related illnesses. So Dr. Frankel, thanks so much for joining us. And by the way, if you have a question for Dr. Frankel while we're talking, you can always leave a comment there and we will get your question answered. So I guess, Dr. Frankel, probably the first and best thing to start with is just defining what it means to have a heat-related illness. Are there different kinds, different categories? Can you kind of break that down for us?
Oh, wow. So great question. I mean, I think heat-related illness is just a category, and it's a spectrum. And the spectrum starts with the basic heat problems that you have, just sweating, feeling hot, maybe feeling a little bit nauseous. And then it can move on to this spectrum where you really start getting chills, feeling a lot worse. There's several types, whether it is induced by the fact that you've brought it on from exercising, let's say, outside in the heat, or whether it just happened by itself. And then ultimately it culminates in something called heat stroke, which we'll probably get to.
All right, very good. So, I mean, I guess perhaps, is there anybody specifically who is more at risk to develop, say, heat stroke or another type of heat-related illness, or are we all sort of at risk, just kind of depending on what we're doing and where we are?
I think we're all, we all have a chance of getting heat stroke, but the really young children and the elderly, those are at a greater risk because they have a harder time sweating and cooling themselves off. But it doesn't mean that everyone else is exempt from it. Everyone is at risk if you don't take care of yourself in this extreme heat.
Very good. And you were talking about some of the signs and symptoms of heat-related illnesses a little earlier. So are these things that kind of give you a little bit of warning that maybe something's not right, or can they come on pretty suddenly and all of a sudden you're sweating or you got the chills or you're just really not feeling well?
Wow, great question. So I think they're warning signs, but we ignore these warning signs. And the way I like to look at it is, imagine this 5-year-old child in the zoo at 105 degrees and mom's not giving them too much to drink. So they're all red, sweaty, irritable, annoyed, screaming. And that's what we are. And that's what we become until ultimately we ignore these signs, and it can lead to something really dangerous like heat stroke.
Yeah. And I mean, maybe good to go into some of the dangers if we do decide to ignore these. I mean, if you get a little flushed in the face, you're like, well, I'm hot, that's no big deal. But these can be pretty serious and cause some pretty serious issues if you do ignore the signs and symptoms.
Absolutely.
And so what are some of the things that it can then go, how it can get worse for you if you do decide to ignore these symptoms and you're not drinking enough water and doing the proper things to take care of yourself?
So of course, there's a lot more to it, but let's go back to like the simple thing that I mentioned earlier. If you have like heat-related illness that you brought onto yourself, let's say exercise-induced heat-related illness, the most severe form at that point is something called rhabdomyolysis, which is total breakdown of your muscles. And the problem is that your muscles, when they break down, they're really, really sticky and they get filtered through your kidneys and they get caught up in the kidneys. And ultimately, you can lead to renal failure and losing your kidney. So that's pretty serious. On the flip side of that, just ignoring these signs and symptoms that we have can lead to heat stroke, which ultimately in and of itself can lead to death if we don't take care of it.
Wow. All right. Well, that's very serious. So these are some things that we have to pay attention to. And in fact, we just got a question, someone wanting to know, when exercising in hot weather, what should you be paying attention to while you're doing that?
So exercising in hot weather, number one, I would tank up really before you do that. Make sure you hydrate right before you do that. And you have to slowly get into it, right? Your muscles can't take a shock and all of a sudden you're running at, 10 miles an hour from 0 and 105 degrees. So you got to break into it really slowly. As soon as you start seeing yourself overheated, like we said, the symptoms of sweating and being exceptionally red and muscle aches. Once you see muscle aches, you stop and hydrate, and hope that it's not too late. But the key to that is really staying on top of your fluids.
Okay. And I mean, it just sounds like your body is going to warn you if something is going wrong. It's just a matter of knowing what to be looking for and then taking the proper steps to try to fix it, right?
Absolutely. Absolutely. We get a free warning, but if you don't pay attention to that, it can have devastating effects.
Absolutely. All right. Another question here what are the best ways to hydrate? Is water enough? Or, we know there's Gatorade drinks. I've seen people drinking Pedialyte. So what are some of your recommendations on the best ways to stay hydrated?
I mean, I think water and, sport drinks are the best ways. I personally would rather sport drinks because it has electrolytes. And essentially what happens when you have electrolytes is all those electrolytes pull in the water and keep it inside of you so that you don't void it and you don't pee it out. Whereas water will just filter through your system and you'll pee it out. It will keep you hydrated, but I think sport drinks are probably the better way to go. And Pedialyte is just as fine. Anything with electrolytes.
Okay, so maybe if you're out gardening, say, and you might just want to have some water nearby, if you have easy access to a bathroom versus if you're, say doing like fall sports practice, maybe the sports drinks is probably the better way to go.
Absolutely.
All right, very good. And speaking of kids, we are getting into the season where they're about to start school. Fall sports are in play. We got practice going on there. So anything specific that parents should be keeping an eye on with their kids or making sure the coaches are watching when it comes to dealing with heat-related illnesses?
I mean, kids are great. They will tell you, right? They're not going to make up these stories, and you can see it on their face and you can watch them. So watch for their typical behavior. Just make sure the coach is giving them a ton to drink. Kids somehow or another ignore these signs and symptoms that we just spoke about. So you have to force them to drink. When they're on the sidelines, make sure you force the drink. And one thing to really look out for, which is a red flag, which do not stop and collect 200 and go straight to the emergency department, is if the children start peeing dark colored urine, specifically Coca-Cola. If you see that, if anybody sees that at any age, stop what you're doing. Do not try to hydrate by yourself. You will not be able to fix it without IV fluids, and you need to come straight to the emergency department if you want to keep your kidneys.
Okay, good warning for us, certainly. Is there anything else that we need to be looking out for that says, okay, you know what, water, sports drinks isn't going to be enough. We got to go to the ER and take care of this?
I think one other thing is, we've all worked out and you all feel like sometimes if you haven't worked out for a while, you feel a little bit achy. It lasts for a day. And some of us really like that ache, no pain, no gain. But the pain that you will get from rhabdomyolysis or severe heat-related illness is an extreme pain, and it's throughout your body. It's very sharp, very painful, and you feel it everywhere in your entire body. Don't ignore that. I would come to the emergency department if you have those symptoms as well.
All right, very good. And, if you think that someone, loved one, maybe your child or, another kid on the practice field might be starting to show some of the signs and symptoms, I mean, should you be grabbing all the ice packs that you can? Should you try and get gallons of water? What is the best way in that moment to try to help the person kind of come out of that?
So the short answer is yes. So it's a little bit of everything. Number one is take them out of the heat, right? So you're on the field, bring them, get them off the field. If you have nowhere to go, get them in shade under a tree. Try to take off their clothing, which is, saturated. Try to put them with wet clothing on is great. If you do have ice packs in that situation, put it in all those places that they're really going to cool off, under the armpits, in the groin. And of course, if they're awake enough, just try to give them as much as they can to drink at that time.
All right, very good. Another question for you, Dr. Frankel, is can heat exhaustion symptoms show up the next day? Maybe you've done a hard workout, or maybe your kid had football practice the day before. Is it possible that they won't show any signs or symptoms until the following day?
I think classically that's when they show up. I mean, it takes time to develop, let's say, like we were mentioning, rhabdomyolysis. So the heat stroke will show up right away. That is it. You've ignored your signs and symptoms, and all of a sudden it's too late. They fainted, they're irritable, they're already in heat stroke, and that's too late. But when you talk about rhabdomyolysis, so you might feel a little bit of an ache, typical, but the next days are when you're going to develop that Coca-Cola urine and those severe problems. It is going to be a day later till it all breaks down. Okay,
so just because you're feeling all good after that long workout outside or that football practice doesn't mean you're necessarily in the clear. You still got to be paying attention to what your body's telling you to do.
Absolutely, and just keep drinking.
Yes, keep drinking. Very good. All right, so, say unfortunately they end up in the ER, they come to you, Dr. Frankel, and so what are some of the things that you guys are then going to do to help treat these heat-related illnesses?
Well, so the first thing is, let's say heat stroke, right? So by definition, heat stroke is going to have an extreme temperature, 104, 105 degrees, let's say. They're really, really burning up. So we got to work to cool them off, whether it is, putting ice packs all over or putting a cooler on them with cold IV fluids. However it is, we got to bring down that temperature because your body can't handle those extreme temperatures. So the first thing that people would get is 1 or 2 IVs so that they can get hydrated really, really quickly, right? The name of the game at that point, especially when you see the Coca-Cola urine, the name of the game at that point is really to hydrate, and prevent all those sticky muscles from getting stuck in the kidney. So the first thing we would do is start IV fluid therapy. And then we would give a medication called sodium bicarbonate so that it doesn't stick and they can continue to pee it out and flush out the system really quickly.
All right, very good. And someone just joining us now. Thanks so much for joining our Facebook Live. We're chatting with Dr. Frankel from GBMC's emergency department, talking about heat-related illnesses. And so, Dr. Frankel, Mindy would like you just to go over the signs and symptoms again of of a heat stroke.
So some of the signs and symptoms are going to be, sweating, red face, irritable, muscle aches. Heat stroke, which is extreme, can lead to seizures, confusion, and ultimately, like we said, unfortunately, can lead to death if not treated properly.
So something to definitely take serious. So if you've got patients coming into your emergency room and they are suffering from some sort of heat-related illness, does it tend to be something exercise-related, or is it something as simple as maybe mowing the lawn in the middle of the day, or gardening, or football practice? What do you typically see when patients come to you and they've had these signs and symptoms?
So I would say anecdotally, it really depends on the age, right? So the little children or the elderly people that were neglected outside and all of a sudden their body temperatures go up and they're not cued in to the signs and symptoms. So those people won't really have any exercise induced type of illness. And those are the scary ones, right? Because those are the ones that can lead to heat stroke. And then you have the other people, that the marathon runners or the people that really are outside, not really mowing the lawn. It's going to be some heavy exercise induced reason for happening. Just mowing the lawn is not going to happen. You may have some irritability and a little bit of muscle aches, but you're not going to have rhabdomyolysis or heat stroke at that time.
Gotcha. All right. Another question is for people just starting to resume, say, vigorous exercise routines, maybe they had to take a break during the pandemic. What are some of your tips on preventative measures that they should take, especially say they're starting it up now when we're still kind of in the dog days of summer, so to speak?
So I think the motto is always start low, go slow. Try not to overdo it. I know we all want to overdo it and we all think we're going to be jogging a marathon and all that type of stuff, but you really have to start off really slowly. Before doing any exercise, you have to make sure you're hydrated appropriately. So if you're waking up in the morning, if you're starting it all early off, then I would recommend hydration, a couple of glasses of water before you even start. Not doing something too extraneous. Make sure you stretch. You want to warm up those muscles before you start so that you don't give it a tremendous shock and all of a sudden they're breaking down. And don't overdo it and try to build yourself up gradually. Start low, go slow.
All right. Very good advice. All right. Dr. Frankel, is there anything else you would like to add about heat-related illnesses that you think is good for our viewers to know, especially since it doesn't seem like Mother Nature is going to be turning down the heat at least anytime soon for us?
I think it's just to, like we mentioned, I think it's just to pay attention to these signs and symptoms that God has been so nice to give us. So if you see these signs and symptoms, the ones that we've mentioned, pay attention to that, act on it, don't ignore it. Try to stay indoors as much as you can. Obviously, it's okay. It's safe to go outside, but just prepare for it. And if you develop any of these signs and symptoms, certainly if they're the severe ones, like we mentioned, just for Coca-Cola urine or someone having a seizure or anything serious like that, by all means, do not even attempt to fix it by yourself and come straight to the emergency department.
All right. Very good advice. And also, keeping an eye, like you mentioned, on the kids, on the elderly. They might not be able to vocalize exactly what they're feeling, but you can probably tell just the base, like you said, on the way that they're acting, that something is not right.
Absolutely.
All right. Well, Dr. Frankel, thank you so much for joining us today on our Facebook Live. Lots of great information, and we are going to post this Facebook Live after we are done here. So thanks, everybody, for your questions, and enjoy the rest of your day.
Thank you.